My name is Dr. Kshama Vechalekar. I work at the Royal Brompton Hospital in London, which is part of Guy's and St. Thomas's Hospitals. I have here a special guest, Dr. Jameson Burke, who is Professor of Radiology as well as Nuclear Cardiology and so many other cardiac modalities, the diagnostic imaging modalities in University of Virginia. Welcome, Professor Burke. This is your first BNMS. I'm very happy to welcome you to this meeting and congratulations on your presidency of the American Society of Nuclear Cardiology. So it's great to have you here.
Well, thank you, Shama, and I appreciate it. I am delighted to be here. So this is my first time coming on a business trip to the UK, and really have just been delighted with the welcome I've received, the fantastic hosting, delicious food. Manchester is beautiful. This has been just a superlative experience. And just really delighted to be here to continue to strengthen the partnership that ASNC has with BNMS. We're delighted about all of the shared in-person and online educational programs and partnerships that we've developed. So this has just been a great experience.
Thank you. It's just a year that is coming to in terms of our partnership with BNMS and ASNC, which was formed last year under Dr. Panik Cherry Tightwing. And we're going from strength to strength. We are hosting MDT, live MDT, then hands-on session, and also some didactic sessions, and also a major session in this conference. How are you finding the program altogether?
It's a fantastic program. Obviously, a lot of comprehensive information in all realms of nuclear medicine. But I think we've had some really robust programming in cardiology. We had our first hands-on session together yesterday, which was standing room only, and really high-level cases with our experts from both the US and the UK going through cases. Looking forward to the session today, New Frontiers in Nuclear Cardiology, and I'm going to be speaking on new trials and tracers in cardiac amyloidosis.
Looking forward to it.
Well, thank you. And I know Dr. Urbane, the president of SNMMI, is going to be speaking on cardio-oncology.
That's right.
So a lot of really good information. And so it's been a great program, and I really look forward to ways that we can continue to develop programming in the future, both online but also in person, any sorts of ways that we can harness the unique perspectives and experiences from the UK and from the United States, I think strengthens the care for all of us.
Fantastic. And I must say that in the past in BNMS, we've always had one single session for nuclear cardiology. But after collaboration with ASNC and with ASNC support, we've been able to do 3 sessions this year, which is absolutely wonderful, covering all the gamut of nuclear cardiology in small but comprehensive manner, the way we are doing it this year. So thank you to ASNC for doing that. And it's great to hear that ASNC is offering a $25 membership for BNMS members and free membership for trainees, which is an amazing opportunity for trainees. And must say, since last year, my trainees have been immensely benefited by that membership. So I think that's thanks to ASNC.
So for ASNC, our international collaborations are extremely important, and we are really interested in having international members who, again, can sort of strengthen our experience. And so we're delighted to offer the discounted membership, and bringing trainees into the organization and strengthening their ability to perform nuclear cardiac procedures is paramount. And so we are delighted to offer them free membership, and that includes access to the Journal of Nuclear Cardiology, access to an enormous number of educational online resources that we have. So it's really a wonderful program, and there's a strong international community that both our trainees and our international members can join, and a very active international committee as well.
Absolutely. And I think you also mentioned about leadership program, isn't it? Developing leaders of tomorrow. I think there is a huge value for UK trainees to develop in that direction. So I would certainly use this opportunity to advertise it for the new trainees and fellows to take it forward and try and use ASNC as a platform. What does that bring, though? What does this entail?
So we actually are very committed to career development throughout the lifetime of a clinician or academic clinician. And so right now we have a Future Leaders program to get folks involved and get them excited about nuclear cardiology. Then we have a leadership development program, and we've actually now added a second level to that, so that there will be 2 programs that can capture people at different levels of their training and early career. And I'm very excited that we are going to be creating a mid-career leadership academy that I am working on with several colleagues in the US. And we are particularly excited that we will want to have international representation in the mid-career leadership academy. So look forward to further details about that.
Thank you. And, we are also excited that we have launched a BNMS ASNC survey in the UK so that we can cater the webinars that are coming over the next year. About 4 of them are planned, and we want to decide on topics. We've got some in mind, but we're going to do the survey to find out what is the real interest, what are the areas of educational need that we can resolve by doing these webinars. So I'm really excited, and we really want to get that input from others, from BNMS members and far and wide in the UK, who can fill that survey, and then we can cater those webinars in which we will have a UK speaker and a US speaker, and probably a trainee who's going to be chairing that seminar. So that way, it goes from the very basic to the very advanced ones. So thank you for doing that as well.
We're delighted and really excited about the opportunity to tailor our educational content to the specific needs for folks in Britain and the UK. We recognize that there are different challenges that you face here than we may face in the United States, and different priorities and different ways that we can sort of best support people. So we're delighted to work on those initiatives.
Amazing. Lovely. I think the partnership will grow from strength to strength and year on year. Thank you so much.
Delighted. Thank you very much.
Thank you.